this work focuses on is a common clinical problem that has major public health implications, and I often think of this as being what I often think of as the chasm of diabetes prevention. So on one hand, we know that patients don't want diabetes. Nobody wants that for themselves in the future. We have ways in normal primary care practice to easily identify patients who are at high risk for getting type 2 diabetes through screening laboratories. And we in fact have very strong evidence about ways that we can help patients prevent diabetes or at least delay its onset, in many cases through even very modest lifestyle modifications. Yet very, very few patients who are high risk for developing type 2 diabetes are engaged in preventive strategies. Part of the problem was highlighted earlier. Many people don't know they have prediabetes, but the evidence thus far is that even when they know about it, many of those people don't do the things that they are consistent with them achieving their longer term goals of preventing type 2 diabetes. So what we're hoping to do in this work, one of the projects in this line of research is a fractional factorial design experiment that will test different strategies from behavioral economics and health psychology to try to improve the engagement of high-risk patients in evidence-based behaviors to help them reduce their risk for diabetes. We'll be identifying and enrolling patients with prediabetes from the Ann Arbor and Detroit VA medical centers, and then we'll be looking at changes in risk factors and self-reported health behaviors over time. And so just to give you a little bit more background, what this normally looks like in current primary care practice, patients who are at risk for getting type 2 diabetes have a screening test through their primary care clinicians. They're given the results of that test through their primary care clinicians. They're given a little bit of counseling about that, and then patients are left with making a decision. Am I going to do something about that or not? So I'm going to go through now, I think, 4 different options for things that we might test in such a type of an experiment, but I'm really interested in your thoughts about what might be the most promising things to test in this space. So the first thing we've thought of testing is a financial incentive. This is kind of what this would look at if you engage, what it would look like. If you engage in at least one of the following things in the next 30 days, you would have, say, a 1 in 10 chance of winning $50. And this financial incentive design we've actually tested among veterans to try to improve adherence to colorectal cancer screening and showed that it led to a significant effect. And so we would essentially apply the same design here. And then these are the options that people would have. Enroll in and attend a weight loss and physical activity program like MOVE, that's the VA's version of their health promotion program related to weight loss, or a local diabetes prevention program. Or you could try to lose weight and increase your physical activity on your own, or you could ask your primary care team about whether medication to prevent diabetes might be right for you. So if you do one of those 3 things and we can verify that, we'll provide a financial incentive, or at least the opportunity to earn a financial incentive. The second thing we thought of testing is a choice architecture modification, which would essentially implement enhanced active choice as well as some what we've kind of think of as affective categorization. So in this space, we would be requiring individuals to choose one of 4 different things, and this is kind of what this would look like. Indicate your plan for preventing diabetes. So I'll participate in MOVE, or Diabetes Prevention Program, because it gives you the best chance of preventing diabetes and getting support from veterans like you. So it would essentially try to stack the deck towards the most preferable options. This, in many cases, these are patient populations where people have low levels of health literacy and low levels of numeracy as well. And so that's why we've also tried to inject into that some sort of affective categorization about what might be the best option for people. The second thing would be trying to lose weight and increase physical activity on your own. Certainly a very reasonable option for many people, yet there's less evidence that would actually work for them. And then related to that, also asking your primary care team about a medicine to prevent diabetes. That is an option for many patients, but again, there's less efficacy with that approach. And then the final choice would be, I will not make any changes, even if it means I get diabetes I could have prevented, and we'll require people to choose one of those 4 things. The third option that we've thought about is some sort of priming exercise after people get their results of their screening laboratory test and get information about their risk. We'd basically take people through a brief thought exercise that would promote some abstract conceptualizations that would help them think about the big picture when they're, I think, often at risk for getting mired in the weeds of, oh, I don't like to go to programs, oh, I don't like having to come back to the VA because the parking's hard and this, that, and the other. Things that get in the way of people doing things that they want for themselves over the long term. And then the fourth option would be some sort of tailored information about people's diabetes risk. This would be drawing on some insights from self-determination theory, which would suggest that if we can align the behaviors with people's goals, values, and aspirations, it might make it more likely that they're able to then engage in behaviors. And here's an example just for somebody who we could ask a screening question, and perhaps we would learn that they aspire to spend more quality time with their grandchildren. We would try to then align the behavioral choices with those goals, values, and aspirations. So my questions for you are these. So first of all, what do you think of these strategies? Do you think they're worth exploring? And if so, how might we modify them to potentially make them more effective? And if so, how? And then do you think there are other things that are potentially more effective? And I think we're at a good stage here where we're going to be doing this work probably over the next year or so. And so I'm really looking forward to your thoughts on what might be interesting and useful things to test here.